Ja, guten Abend und herzlich willkommen zum Webinar Stomatitis und Gingivitis. Mein Name ist Holger Neusnick von der Firma PHYSIA und in Zusammenarbeit mit ASA Laser veranstalten wir das heutige Webinar. Unser Referent heute Abend ist Dr. Adelmo Rosin aus Italien. Er ist ein erfahrener Anwender des ASA Lasers, arbeitet selbst damit und hat schon zahlreiche Seminare und Webinare zum Thema Therapielaser gehalten. Jetzt zum Ablauf. Wir würden eigentlich gleich mit dem Thema Stomatitis, Gingivitis und Adelmo starten. Und Sie können auch gerne während der Session Fragen stellen über die Chat-Funktion. Diese würden wir dann nach dem klinischen Teil des Webinars dann auch beantworten oder Adelmo würde die beantworten. Und wir haben dann im Anschluss daran im zweiten Teil nochmal für Leute, die vielleicht den ASA Laser noch nicht haben, die daran interessiert sind, nochmal ein paar Grundlagen zur Lasertherapie und insbesondere zum MLS Laser, was ihn so besonders macht, zusammengestellt. Das würde dann Roberto Turrizzi im Anschluss daran machen. Das ist dann wahrscheinlich für die Leute, die einen ASA-Laser schon haben, dann eine Wiederholung und die können sich dann natürlich gerne abmelden. Das ist kein Problem. Ne? Ich würde dann übergeben an den Roberto Turrizzi von ASA Laser und er wird sich auch nochmal vorstellen. Ne? Viel Spaß.
Welcome to everybody. Thank you very much for your availability to join us in this new webinar about gingivitis and stomatitis. Let me introduce you Adelmo Rosin. Is degree at the University of Parma in veterinary medicine. He followed a course in rehabilitation and physiotherapy for small animals at the Faculty of Medicine in Vienna, in Austria. He has got a master in behavioral medicine for companion animals in the Faculty of Pisa. And Dr. Adelmo Rosin is our clinical trainer for small animals. Basically, the agenda of tonight, we will talk about the clinical part, how to make the treatment, the protocols, the assessment of gingivitis and stomatitis. And then we will have a break with a question and answer. So I invite you, if you have any question, to use the chat media. And we will try to answer to all the questions at the end of the clinical part. And then the second part, we will focus a little bit about the product line of MLS, what is specific, the background, and we will present you all the features of our laser therapy product, especially for the people, for the participants who are evaluating to purchase a system, so potential customers. So thank you very much again. Let's start with the clinical part. So I will pass the speech to Dr. Adelmo Rosin.
Okay, good evening everybody. Let's try to begin with the clinical part. And this evening we'll try to see how can we use the laser in such a very big problem. Then to begin, obviously we all know, especially in the cat, what is the problem that gingivitis and stomatitis can give regarding to the, starting from the young, from the kitten, arriving to the young cat and to the old one. We have several parts of the same disease to examine, and we begin, first of all, to try to understand with the classification what are we talking about. We normally say that we are dealing with a severe inflammation in the oral tissue that heavily, sometimes more or less, impairs animal health, affecting gingiva and mucous membrane. Sometimes when it's a more severe situation, it can be located in the lower part of the mouth, and so we will talk about the fasciitis, and this is the classification we'll see later. But one of the most important things to underline is that as it is always associated with inflammation, ulceration, and big pain, the animal normally stops eating because it feels a lot of pain. You know that many times when we talk about this situation, the pain is very high, and especially in cats that living in the house that are overweight, when they stop eating for a few days, it can be a little bit dangerous for their hepatic health. Let's see only very fast what happens in dog, because it's involved, but only a few. In my practice, I noticed that for one dog with gingivitis and stomatitis, normally I see over than 100 cats and more. So it's quite uncommon, but the same situation to the dog gives the same symptoms: pain, inflammation, and stops eating. This can be very hard to face for the owner, and then when we are trying to see some more information about which is the reason why, we can have some inflammations linked to the Candida albicans, a fungi, some metabolic disorders, often linked to the kidney failure, gingivitis by itself linked to the oral condition, because a lot of stones, a lot of problems linked to the teeth. Sometimes we are dealing with the immune-mediated problems, with the infiltration of immunitary cells into the mucosa, or it was discovered a fusiform bacteria, Spirocheta, and it's the etiologic agent of the trench mouth. But go back and go on together with our cat. Oh, sorry. And we know that in the cat, based on several books, we have a different classification and different names, but all them to describe the same situation. It's called feline chronic stomatitis, feline gingivostomatitis, phositis when it overlocated in the lower part of the mouth, with the FCGS or feline stomatitis. And another classification is based on the location of the affected area. In the type 1, it's easier to deal with, and it's an inflammation in areas of the oral cavity, while the type 2 in the caudal area of the mouth. One thing that we can see is that we can normally face a lot of patients with different ages with the same problems, starting from the kitten, and when normally they took the virus from the mother, and normally we're talking about calicivirus and herpes virus, and the situation going on with the age and with sometimes with the therapy or the lack of therapy, depending on how live the cat outside, it's a stray cat, or the owner waits too much, we can have a lot of complication linked to the presence of bacteria, some kind of bacteria that can involve the normal microbiome in the mouth, but they can be very complicated by the plaque that is developing. And we know, as we saw, from up to 88% of cats have the presence of herpes and calicivirus, sometimes both of them. And you know that herpes virus is always coming back in the stress situation, while calicivirus often becomes remains for a very long period inside the mouth, causing the loss of teeth in many situations. Sometimes you have bacteria too. Bartonella is one of them, but it's not the only one. And another situation to take in account when you have to deal with this kind of problem is the fact that the immunitary system of the cat can be less effective because the cat can be positive for FELV or FIV. In this situation, the answer to therapy can be very difficult. And so you can find a list of most of the common symptoms during the gingivitis and stomatitis. Obviously, to make this classification, we base this classification on the symptoms. One of the first thing is that if we are able to open the mouth of the cat, because to handle with this patient normally, when they saw that we are going closer to the mouth, they are very worried because they feel a lot of pain. We can have a reddish mucosa in the, they are more red in the mouth. We can sometimes have ulceration of oral cavity, especially in the tongue. And they develop a lot of other symptoms linked to the situation, like halitosis, because they have a severe infection in the mouth, dysphagia because they feeling a lot of pain, they eat but only a few, they change the kind of food, they begin to eat something that is not so hard like kibbles, and then they are reluctant to take food, sometimes they stop eating, and they can have weight loss, and they can have opaque hair because they don't lick themselves, they don't make the normal grooming behavior because they feel a lot of pain, and so their hair is in a bad situation. We know these are the situation, the therapies that have been proposed, sometimes together, sometimes one after the other, or both, many of them all together. Normally they have, first of all, the dental care that must be important, but sometimes you can find only the inflammation without any needing to go to the cleaning of the mouth. In many situations, what they need or what we do is the teeth extraction, or in some cases you have a proliferation of the gingiva and it begins to cover part of the teeth, and so in this case you need a laser surgery to cut away the part of gingiva. Sometimes it's necessary to administrate to the patient immunosuppressive drugs like steroids and in some cases cyclosporin too. Normally, the first drug we use are painkillers like NSAIDs or steroids, and then sometimes we try to use something able to fight the principal etiologic agent like virus. In this case, sometimes we use interferon, or sometimes we can move and try to make an implementation with lysine in the diet, and then to use antibiotic drugs or especially antibiotics to see if we can get a good result. But some patients don't respond in a good way to all these, or too many of them, drugs that are administered. Because especially talking about antibiotics, many of them are very effective for the first time, the second time. Moving from the third or fourth, the microbiome changed, they developed a lot of resistant bacteria, and the antibiotic has not the same effect. Another thing to take into account is the formation of, we call some gingival pockets, where the bacteria live inside and they can't be reached from the antibiotics. And some patients have completely no improvement from the therapy. So in this situation, we say, oh, let's use the laser. This is right, but this is wrong too, together, and I want to explain why. Because if you only think to the laser like the therapeutic way to use when every other thing didn't work anymore, that's not an ideal situation, because it means that the situation was going worsening during the months or years, and then at the end you apply the laser. When you apply the laser, you have a different reaction if you're dealing with an acute situation developing for the first time, or you're facing a situation that has a long history. So the effect of the laser is at maximum level when you use the laser immediately from the first time that you have to deal with a patient with gingivitis and stomatitis. So, as we are doctors, we need to get the correct analysis, but in this case it's very easy to arrive to a right diagnosis and to use the proper protocol on the device to get the best result that we can have with the patient. And so after the assessment of the patient, I will choose in the device the right protocol for gingivitis and stomatitis, and I begin the treatment. What can I expect when I use the laser? As I told you before, if I begin to use the laser in an acute phase, especially in kittens, when they normally are less than 1 month or 1 month of age, they are going to develop a lot of symptoms because they develop fever, they have drooling, they don't eat, and so on. In this case, laser works, it's something like something magic, let me say, because you are dealing with the first time that the cat is developing the symptoms, and is very, very effective because the tissue had no treatment at all with other situation. Different situation is when you are facing the acute form in an adult cat, but sometimes remember that the adult acute situation is a develop of the chronic one. It means that normally the owner takes the cat to the clinic when he stops eating. And then when you make a good anamnesis, you discover that the cat is 1 month that eats only a few, stopped to eat kibbles, moved to a softer food, and at the end only licks the part of it and leave the food. It means that it feels pain from more than 1 month, but the owner took you, the cat, for an acute situation, but it's an acute situation based on a chronic one, and it means that you're facing an old problem. The result in this situation can be very different. For example, while in the kitten you can see the result after 1 or 2 treatments immediately, in the chronic one or in the adult chronic, when it's a reacutization of a chronic problem, you need more treatment. The worst situation is when you are dealing and when you are treating a cat with a chronic stomatitis, and you know that he made, for example, a lot of steroid during months or years. For example, often is used a deposit steroid, an injection that lasts up to 3-4 months. Or sometimes we are dealing with a patient with an immunitary system that is compromised from other infection like FIV and FEL. In the last situation, you normally need, you begin to see the result after about 7-10 treatment, depending on the starting situation. I mean that in the case you have to deal with a patient that is has made deposit steroid for a long time. He began 2 years ago, and now they can't do it anymore because the injection that lasted up to 4 months at the moment lasts no more than 15 days, and they have the problem that the patient can develop or diabetes or Cushing syndrome. In this situation, if you think to the effect of steroids on the connective tissue, you can imagine that you have no more tissues able to react to the laser stimulation. We can fight the pain, we can fight the inflammation, but we are not able to go and stimulate the regeneration of the connective tissue directly in the gingiva. So this is a very big problem, but it doesn't mean that the laser is not useful. The laser is really useful, but you'll see results in a longer time. So you have to advise and to tell the owner of the cat, yes, in this situation, we need a lot of treatment. We'll see the result, but in a longer period of time, instead of after 3 or 4 treatments. Another situation to take into account is that you're dealing with a patient that feels a lot of pain to the mouth. And when you get closer, he begins to worry, and normally they try to avoid to be treated. In this case, laser can help you a lot, because with a normal handpiece that Roberto will explain you later, you are able to treat the gingivitis from the outer part of the mouth. You don't need to open the mouth. You don't need to put inside the mouth the intraoral applicator, and you can stay avoiding to touch the skin, the surface of the mouth, half centimeter from the cat, sending all the energy, all the therapeutic level of energy to the gingiva, and so you can make a good treatment with this kind of patient that they don't even collaborate anymore. And then two things to take into account. If you have dealing with a bleeding lesion, wait up the stop of the bleeding, because mucosa is very fast to recover, and don't even use the laser when you are dealing with the suspected neoplasia. So if necessary, make an anesthesia to the cat, make a visit, especially in old cats, to see if the situation can be faced in this moment. Then, what to check before the treatment is how old is the animal, which is the state of the pathology, acute, chronic, neochronic, and situation. It's a chronic viral case, and all the situation to take in account, as I told you before. Based on this, I will have to choose the number of treatment, the maintenance to do in the next months, and if necessary, to arrive when needed to the teeth section. Normally, if you begin to use the laser since the first time that the patient has the symptoms or gingivitis, you don't arrive to the teeth extraction. These are the parameters, but I go faster because one thing is very important is the parameters are inside the device, and I want to underline only one thing. The level of energy that we supply in this kind of pathology is very, very, very low, 0.16 joules centimeter square, and I'll explain you later why do we use this level of energy. These are some tips to considerate. The first thing is you can stay outside without open the mouth, and if you're dealing with a fasciitis that is located in the lower part of the mouth, you can make a treatment by the outer part with the handpiece under the tongue. So you will be able to send the energy to the lower part of the mouth without opening the mouth of the cat. Sometimes you can deal with an acute case based on a chronic, as I told you before. In this situation, you know that you're not facing an acute, and so you will need more treatment to get result instead of an acute, in a pure acute situation. And then when you're dealing with a chronic situation after steroids or with an immunocompromised cat, you will need more treatment. So don't think that the laser doesn't work or it's not effective with this patient. You have to make more treatment. And as I said before, slow release steroids can be very, very hard to face. Now, this is a scheme to try to explain in a better way how to use MLS. When you make the right assessment, the first thing to ask is if there are any contraindication, in this case, neoplasia. So if you are dealing with the tumoral tissue, do not treat the cat. It's a contraindication. One of the few contraindications of the laser is don't use the laser on tumors. And then you have to consider which is the condition of the cat, if it's a chronic one or an acute one. Starting with the acute, that is and it's easier, you make the right protocol, setting the acute gingivitis program in the device. The first week you make 3 treatments, and you go on up to see a result. Normally after 3 treatments, if you have an improvement, okay. If you're dealing with an acute and you don't have any improvement, make a reevaluation of the diagnosis. Maybe the cat is young, but he can be FEV positive, or he can have some other problems, is developing other problems. If you have a good result, it means that after 3 treatments you should begin to see the cat that is feels less pain. It begins to eat again, begins to make a normal life. You go on with the treatment, arriving to 6 treatment. Normally with 6 treatment in a kitten, you can have a good result, but sometimes it's better if you go on for other 2 or 3 treatments, because if you stop early, you can have again some symptoms in the next weeks. This is a little bit complicated, but it's because we are dealing with a complicated pathology, because we know that gingivitis, stomatitis is the definition of the clinical situation. The symptoms, we saw them before, but we can have several causes at the base of the development of this pathology. So if we are dealing with a chronic and the cat was taking slow-release steroids, avoid them. If you need to decrease the level of inflammation and pain, move to quick-release steroids for 4-6 days to have the cat to eat again. So we are going to avoid any problem to the liver, and start the treatment with chronic stomatitis, and then go on making 3 treatments per week. After 4 or 6 sessions, go and make a clinical evaluation. And this is a very important point to underline, because sometimes you can have young cats developing all the symptoms, and they develop a very with a big inflammation at the base of the tooth. You see like the dark part at the base of the tooth. But after 4 or 5 treatments, they begin to have less symptoms, they begin to feel better, but this situation is not completely healed. Sometimes you need more treatment, sometimes you arrive to a balance where the cat has still the presence of this inflammation, but no symptoms. So in this situation, you normally need some maintenance program. And then after all, if you don't have any improvement, sometimes you need an X-ray, because in some cats you have they lost some teeth, but some roots remained inside the bone, and they were covered with the gingiva, so you don't see, and you need an X-ray, because if the root is present, you need an extraction of the root. And if you go on with the clinical evaluation, sometimes you can have the needing to make biochemical analysis. For example, some cats can develop some symptoms linked to the kidney failure in an acute stage or in a chronic one. Often the chronic one is very, very hard to face. And then if you have a clinical situation like chronic kidney failure, uremia that is developing gingivitis and stomatitis, or diabetes, or chronic viral infection, go on with the treatment for the mouth with the laser associated to the clinical therapy for the reason of the development of the problem. And then go on with the treatment, and if necessary, make the extraction you need, or you make a maintenance program when you have or the treatment arriving to the complete healing, or the treatment arriving to the situation where the cat doesn't feel anymore any pain, is able to come back to eat, and normally this kind of patient needs 1 or 2 treatments per month, or 3 treatments per week every month or every 2 months for the whole life, because they are dealing with a chronic infection in the mouth based on herpes and calicivirus. Then the chronic, to underline, you will talk with the owner to see how is the situation, to talk with the owner for the maintenance program, and you can base some protocols for the to avoid again the development on an acute situation, making the treatment before it happens a little bit. For example, you made 10 treatment, the cat is developing the problem after 3 months, you make another treatment, and you say to the owner, well, the last time the effect of laser lasted 3 months. Now, after 2 months, come back in the clinic. Instead of make 10 treatment, we make 3 treatment that week, and it can be a very good way to make a maintenance, avoiding every time the patient to feel pain during the months, during the years. I'm going to introduce you an article made from Dr. Paolo Squarzoni, an Italian vet skilled in dentistry. He only works in dentistry, and he's the one who prepared us the protocols that you find in the device. He made, with Monica Monici, a study in the cat, taking two different groups of cats. All these articles can be given to you from Roberto if you need, and they are very interesting. And he prepared two groups of cats and of selected cats. He made the treatment with MLS remaining outside the mouth, and he made a clinical evidence of what happened, and to get more data, he made biopsy and made examination of the biopsy. This is the situation. At the beginning, group 1 and group 2, the first group was treated with 0.32 joule centimeter square, the second with 0.16, it's the value in the device. And this is the clinical evaluation in a group at the beginning and at the end in the big picture of the treatment. This, in the upper part, AB is the group 1 before A and after B, the treatment, with 0.32 joule centimeter square, while the second, the two pictures, C and D, are the same, the other group, but the same patient before and after the treatment. In this biopsy, you can see a lower number of inflammatory cells, immunitary cells inside the tissues, and he made another study with immunofluorescence analysis, and he was able to demonstrate that the treatment with the laser was able to reduce the number of T lymphocytes in the mucosa. And now let's go to see a clinical case. One moment. This is a case from Thailand. It's involving a young cat that arrived in the clinic. It's a 5-6 month old, and he had all the symptoms of a herpes and calicivirus infection with gingivitis, stomatitis, tongue ulcer, but fever, mucopurulent nasal discharge, and sneezing. This was the situation of the cat when it arrived, and they made all the treatment with a normal therapy plus immunomodulation, antiviral agent, antibiotics, saline solution, mucolytic, and then they begin immediately with the laser. They were very lucky because this cat was so good that they were able to use the intraoral, and so they were able to open the mouth and to make the treatment directly with the intraoral applicator. You can see the difference of the color of the red during the treatments. The tongue ulcer was healed after 2 treatments, and then all the other tissue going on with the time were less red, had less inflammation, and they were able to reduce the number of points to make during the treatment. Another very important thing is that the vet suggests to make cycles of maintenance laser therapy, sometimes associated to the normal drugs that is normally given in this situation. Sorry, oh, I'm sorry, I choose a bad, I'm sorry. I come back to the presentation. Now, what can we offer talking about the laser in this kind of situation? One very important thing is that we can make the treatment, and you can see the treatment outside the mouth, in an effective way, in non-invasive, with a fast and long-lasting result. And now I leave Roberto to explain you how can we be so effective when we use the laser during this kind of problems.
Yes, thank you very much, Adelmo. Basically, ASA has focused all the attention to provide solutions based on laser, completely safe. In other words, our goal is to provide, to give to our customer the possibility to use the power at the 100% intensity without any risk of thermal damage, any risk of burning. And basically, as Dr. Adelmo was mentioning, these are the goals of the laser therapy, basically to reduce the pain, to reduce the inflammation level, and the edema and hematoma, thanks to the mechanical effect, photomechanical effect of the laser. You can spread out the liquids through the lymphatic system faster than the normal situation. Moreover, you can get a reparative and regenerative action thanks to the photochemical action of the laser, MLS, which speed up, let me say, the natural process at the cellular level. Basically, how is working MLS laser therapy? MLS laser therapy, when you press the button, there is an emission of two laser emission, one pulsed and one continuous in the same time. Basically, we have two patents. One based on the synchronization of these two emissions. Why two emissions? The pulse is more, let me say, focused on anti-inflammation and anti-edema, and the continuous on the pain reduction. So synchronized together, basically you get the three effects in the same time. Moreover, we have an optical group in front which merge the two emissions in order to have an homogeneous treatment over the tissue. So as you can see in the picture. Basically, so we have two specific wavelengths, and you know the penetration of the laser depends first of all on the kind of wavelength, because the wavelengths are, let me say, the key factor to penetrate in a certain penetration level. And of course the power is necessary in order to trigger effect at the cellular level. Basically we have a specific protocol to treat specific animal, and talking about the penetration, sometimes it's not clear the difference between a surgical laser and a therapeutic laser. Here in this picture, we can see in the axis, in the in the horizontal level, we see different kind of wavelength, and in the vertical line, we see the level of absorption of photons by different kind of chromophore, like hemoglobin, melanin, and water. For example, you can see in the range higher than 2000 nanometer, the emission of the photons is absorbed only by water. Okay, that's why this kind of range is much used for surgical laser. Why? Because the superficial level of the skin is 90% water. If you use this emission, you are sure that the photons are absorbed only by the water, and so the cell at a certain level explode because they absorb too much energy, and you can cut. For the therapeutic purposes, we need wavelength in the therapeutic windows, which is the brown one. Why? Because yes, we need absorption of the photons by hemoglobin, by melanin, and by water, because otherwise we do not have any effect. But at the minimum level. Why the minimum level? Because in order to give to the photons the possibility to penetrate deep in the structure, in the muscle, in the tendons, in the joint. Okay? That's the big difference between a surgical laser and the therapeutic laser. Basically, this is the patent. Basically, when you press the button, you have this synchronization of emission between the pulsed emission and the continuous emission. And here we have a patent. So our modality is patented worldwide. And the patent is based on the synchronization, but also on the optical group which merge the two emissions. Why this is good? Because basically some other solution, they have this kind of shower, okay, emission. So they have different point of emission, but on the skin, different points are treated in a different way. And you don't know what happened between one point and the other point. So there is not homogeneous. With MLS, basically, thanks to the optical group, the treatment is very homogeneous. You can see on the right part of the screen. And with the small end, we have two different handpiece, the small and the big one, called Charlie. With the small handpiece, the spot area is 3 square centimeter. And with the big handpiece, the Charlie, the spot area is 20 square centimeter. But as you can see, the treatment area is very homogeneous. So you can treat up to 3 square centimeter or 20 square centimeter, deep up to 4 or 5 centimeter depth. So you treat all the volume, all the cylinder in the tissue in the same way. Another important point, this is our product line. We have, let me say, 3 different range of products now. One is the blue one, the other is the orange one. What is the difference? The difference is that in the blue, we have specific protocols for small animal and equine. In the orange, we have also specific protocol for exotics and also for acupuncture. So basically, the handpiece, the small handpiece, is useful to treat small animal and especially local treatment. But if you have to treat big animal like horses or big dog or big animal, you can use also the Charlie. Basically, the system comes with 2 different independent channels. So you can use the small one and the big one in the same time with 2 different protocols. And you can, eventually you can upgrade the system also with the Charlie without changing anything in terms of hardware or software inside the system. This is the standard handpiece, and this is the handpiece that we have with the orange, because the orange product line, you have also the capability to do oral treatment inside the mouth or acupuncture treatment. The most important part of MLS is that with the MLS, thanks to the patent, you are not forced to do the treatment only by scanning. What does it mean, scanning? Moving the handpiece over the skin. But you can do also treatment point by point, so staying steady in the point, and this is very important because basically if you provide energy point by point, the system gives you exactly how much energy you provide in that point. And the system gives you exactly the numerical value. And for example, if you have an old dog with arthrosis, this is much better because you can, point by point, you can spread the energy around the joint and you are sure that this energy penetrates inside the joint. While the scanning is good for if you have a big muscle contraction, but for arthrosis, for example, in the joint, if you do scanning, you are not sure about how much power you provide in a specific area. While with point-by-point treatment, you are sure 100%. Now, Adelmo?
Yes, I'm here. And
yes.
I tried to, I don't know if you see me, but can you hear me? Because
no, I cannot see
a small delay of the...
Okay.
And, thank you, Roberto. And as you can see in the picture on the right, this is the administration of energy with a point-by-point system. Making this kind of administration, you get the best result because if you stay still in contact with the skin 90 degrees, you reduce a lot the reflection. That is it's a loss of energy because it's reflected and doesn't go in the tissues. It's very dangerous because normally you're dealing with all the therapeutic laser that works in the infrared wavelength are emitting an invisible light, and this reflection can arrive to your eyes, and so and you don't know because in this situation you can see it. And talking about the ability to perform the healing of the tissues, it goes in deep and we send the energy in depth in the tissues, and as it goes down, you release, the system release, and the photons are making an interaction with the skin, having all the supplying all the energy they need, because you have the activation of the photoreceptors that are in the cells, or in other part inside the cells, like, for example, the mitochondria. And this is very important because, as Roberto told you and he explained in a very good way, with this kind of emission, we are able to work with a lower level of energy. Normally, for example, in many programs, we work with 4 Joule/centimeter², and this value allows us to stay in contact with the skin of the patient without causing any discomfort, not damages, but the discomfort too is very important, because when you deal with an animal that feels a lot of pain in the part of the body you are going to treat, if he feels a little bit of discomfort, he, in the next settings, will try to avoid you when you go closer to make the therapy. And this is very important because this result can be obtained only with MLS, because this value of energy is more than enough to get the biological effect. Then another very important thing is how easy is to use the MLS, because you choose in the first, on the left side of the slide, you choose, for example, companion animals, then it opens, you choose the pathology, the area to treat in point by point or scanning mode, the color of the skin or of the hair depending on the situation, and the size, not of the dog, but the size of the area, and then you push start and you begin immediately the treatment. In a few seconds, you are able to turn on the device and begin the treatment of the patient.
Ecco, Dr. Adelmo, just one second, just to do some questions, because if you come back to the previous slide, because one participant, Marius, asked how many milliwatts should I use treatment per treatment session, how many minutes, and so on. All this kind of information, if you see on the bottom part of the screen, whenever you choose a protocol, the protocol gives you exactly which frequency, everything is ready, which frequency with the energy, which how long time does it need, and so on. So you have a full information in front of you before starting the protocol, but also during the treatment itself. So it's ongoing. So you have
and you
all
can
the
see
information.
No, don't worry, the density of the energy, but the total amount of the energy that you will supply at the end of the treatment. This is 201,900. It's not 201,000, remember, because they are too much. Then let's try to see in a fast way why are we effective, because one of the most important things of MLS is that all the studies that now I'm trying to explain and all the results we get were made with MLS, with the same device that we are talking now. So the title is Beyond the ATP, because very important to underline, in the 1980s was discovered that the laser therapy was able to increase the ATP production, stimulating the mitochondria. So all the sellers told, oh, my laser is able to increase the ATP production. Yes, but it's more things about the ATP. Because, for example, if you take in account this slide, here we go, you can see this strange name, PP1 protein and LRP10 protein, ATP binding protein, and so on. This was a study. It's made in a fast way, but a study lasted more than 2 years, and was the ability of MLS to stimulate the production of protein. This one is very important for the muscle metabolism for the deposit of glycogen and how to and when to mobilize it. The other one was a protein that has an anti-inflammatory effect, reducing the amount of interleukin-1 beta during an acute inflammation. These are proteins that are able to link the more production of ATP, because you know that ATP can't be stored, and the antimicotic activity that was that is easy to obtain with the MLS protocol, and all of them work together to reduce pain, edema, inflammation, and the healing of the tissue. This is what we get, and the image that we saw before, the picture we saw before for the Tony. So we have less inflammation because NLRP10 acts reducing the interleukin-1 beta production. Wound healing is with all the effect of the laser, photochemical, photomechanical, and photothermic, we are able to reduce and to get all the protocols to heal the tissue, reducing pain, edema, inflammation, and to start the new formation of extracellular matrix. So we are going to stimulate fibroblasts to produce more and more tissue. And a very important thing is the analgesic effect that can be noticed since the first time. To witness the ability of MLS laser was made a study on Candida albicans. I don't want to be boring, but the most important thing is that after a specific protocol made at time 0 and after about an hour when the colony was beginning to multiply, using the laser for 2 or 3 times in the same setting, we had a very high percentage of reduction of colony number, up to, in some cases, of over the 70%. And we have arrived now at the end. I wish to thank you for your attention, and if you have any question, I can try to explain or to answer your question.
Yeah. I mean, I have one question, actually, even before that session, and that was one from one of our doctors, and she was asking how soon can the treatment with the MLS laser be started after extradition of a tooth? How soon can it be?
Okay, we have 2 situations. The first thing is we have a contraindication for the bleeding because we increase the temperature and we are going to cause a vasodilation. So if you have bleeding, don't use the laser over the area where you have the bleeding. So you have to wait up to few hours before making the treatment. But at the moment, instead of treating inside the alveolus of the tooth, you can treat in the surrounding area in the gingiva to reduce the pain and inflammation. But inside where you had the bleeding, you don't. You have to wait a few hours or a few hours after the bleeding stopped.
Okay.
The other question was, can I use the laser handpiece on the gum directly if the patient opens his mouth?
Yes. I told you that we are able to work with the closed mouth, but it's normally made to avoid to touch a painful mouth. If the patient can bear the opening of the mouth, we can make the treatment on the gingiva too directly, because the supply of energy, as you saw before, is very, very low, but it's quite enough to get all the result. And so if you're able to open the mouth of the head, you don't need to change the head all the time. So you can make the treatment directly over the inflammation in the area of the gingiva.
And the other question is, can I use the laser after the dental cleaning?
Yes, it's a very good thing to do, because from the study we made, when you're making, we normally, a lot of time we use antibiotics before making the dental cleaning to reduce the number of bacteria inside the mouth. But with the laser you can reduce the bacteria too, because we have an effect on the bacteria, a direct effect, and we can reduce the pain and the inflammation after the cleaning with the ultrasound. So you make the ultrasound cleaning. When you make this kind of cleaning, you can cause a little bit of pain, inflammation. And then after the treatment, you make a laser scanning directly on the gum of the cat or of the dog.
There was another question. How can I protect the eyes of the cat from the laser? Basically, with the system, we provide two pair of glasses, protective glasses. One for the operator, one for the, let me say, assistant. For the cat, usually we suggest not to put protective glasses over the cat, over the face of the cat, because the cat is already very nervous. But eventually the assistant should cover the eyes with his hand during the treatment. Otherwise, there are goggles like swimming goggles, but of course the swimming small goggles with elastic to protect the eyes of the cat. Regarding the power, another question was which is the power level of our system. Basically, let me come back to the echo. The blue line has a peak power of 25 watt. The orange line has a peak power of 75 watt. Okay. Basically, with the orange line, you, based on our clinical, let me say, experience, you get the reduction not on the single session, but on the global treatment plan of around 20-25% of the time. Okay. Just in order to talk about power, a new product that is just we just released. It's called MVET. The MVET basically is a completely new product with a new, let me say, layout, a new handpiece, and a new user interface. And basically we have a different kind of applicators that in order to replicate the standard handpiece and the Charlie and the acupuncture tip and the oral tip, with a certain electronic. So basically the system feel when you change the tip and automatically change all the protocols, as you can see here. And the peak power of the MVET is up to 270 watt. Still with the same patent of MLS. So still in the safe, completely safe modality, still with the same background of the other two product lines. So exactly the same. So this product is we are going to deliver. We launched this product in January, so it's available. And this is a, let me say, third product family in addition to the Amphi Blue and the Amphi Orange. So I advise you to contact your local dealer in order to get more information about this kind of product. Now, I don't know if do you have more questions?
I think there was one interesting question from Amy. It was, can you do a pulse mode to avoid heating? And that is, I think, very special.
Yes. Basically, MLS, the main energetic component is based on the pulsed emission, in order to give the time to the tissue to absorb the energy, but also to cool down the energy. I mean, to disperse the energy that is not absorbed by the cell. In this way, you can use the power at the maximum level, point by point, with the point-by-point treatment, without any kind of risk of damage, thermal damage.
Also any thermal damage with the MLS laser is totally excluded, so it cannot happen.
Yes.
Then there was another.
Yeah.
I think there was some other questions regarding the treatment protocols, but this I would like to ask you. You can send us an email, at info@physia.de, also info@physia.de, and then we can give you some maybe details. Also, Roberto, I don't know whether this presentation is available after the session. Maybe also in specific cases you can ask us by email if you have any kind of question.
Yes.
And then there was another question coming. So if you can't open the mouth, you apply the laser to the lip and it goes through the gingiva. The connection was bad, so she couldn't understand it. That was another question.
Yes, true. It's true. As Roberto told you, we are using the most penetrative wavelength in the market. So when you apply the laser by the side of the mouth, it goes through the muscle of the mouth, right to the inner part of the mouth and to the gum that is over the maxillary bone, mandibular bone, and you reach all them going through directly. The same effect you have in the fasciitis when you apply the laser under it goes through the tongue, arriving to heal a tongue ulcer, for example, and all the mucosa inside the mouth that is by the bone. Because remember, the laser is not able to go through the bones. The only bone that can be passed normally is the skull.
Okay. It looks like there is no any more questions.
Also, I would suggest that if you have any additional questions, or in some cases where we didn't answer the questions now, we don't want to extend too much. We are already at 1 hour. That was a little bit longer than we planned. But you can always contact PHYSIA via email, and then we are happy to answer your questions. Also regarding prices or offers that we would like to do on a face-to-face situation. But you're very welcome to contact us at info@physia.de, and then we are happy to answer all your questions. So thank you very much for attending. Roberto, I leave you the last word.
Yes, I thank you very much to everybody, to all our guests from Germany, from Austria, from Turkey, from Egypt, from Latin America, and from South Africa. So thank you very much, and have a good night. Thank you. Bye-bye.
Good night. Bye-bye.